Assalamu alaikum wa rahmatullahi wa barakatuhu. My dear brothers and sisters and respected elders, I hope you're all well. Today I'm going to show you something different, and this is really important. We are now in the blessed month of Ramadan, alhamdulillah, and many brothers and sisters increase their prayers during the month, increase the time they stand in prayers, increase the time they're sitting in prayers, etc., etc. And a lot of us, how can I say, our bodies may not be as flexible or as strong, and we face back problems, neck problems, leg problems. And I've been speaking to a few brothers and sisters as well. So alhamdulillah, today I have with me here brother Shareef. He is from VI Therapy. And this brother, trust me, if you want to know about anything about physio, cupping, anything to do with, therapy for the body, you need to come and check him out. I'll put a link down below. Brother Shareef, assalamu alaikum.
Assalam. You okay?
Alhamdulillah, I'm good, bro.
Alhamdulillah.
Now, brother, the reason why I've come to you today is to get some hints and tips of how to stay mobilized, flexible during the month of Ramadan and thereafter as well. Because a lot of us during the month, obviously, we're not as active as much, but we're more active in salah, more active in sitting down. So the aches and pains do tend to add up, and especially as you're getting older. So if you can just generally just give us just a quick advice, and then obviously we'll go into the physical part of it. So what tips can you give us during this period?
So specifically in Ramadan, obviously it's not. If you look at general how the body works, the body is not used to standing for long periods because the body is either active. And it depends on the profession and what people do.
Sure.
So people who are office workers are used to maybe sitting in a still position for long periods, and that's what they get used to.
Mm-hmm.
Bus drivers, similar, taxi drivers, people who are sedentarily sitting. Other people who are maybe have standing professions, they are slightly different, so their body is used to that kind of position.
Right.
So for the general population, or general Muslims, Ramadan is different because you're continuously doing an action. People who pray 5 times, it's a big shift. The body is taxing for the body as well. So what I do is similar to a sport. You have to look at is your body ready for that kind of work.
Mm-hmm.
So if it requires a lot of standing, is your back strong enough for that? Is your ankles stable and things like that. So what we can do is we'll inshallah break them down. So the main areas I feel that a lot of people find their pain is possibly the calves,
Mm-hmm.
because the calves in standing is controlling kind of your weight going forward and back. You might put some pressure on your toes, then you might go back, and that's the calf. And again, depending on how many people are there,
Mm-hmm.
if you're in an awkward angle, again you might feel it in your lower back. Because obviously the pressure, sometimes it's a long dua in witr, for example.
Right.
And I think that it's going to get longer as the days go on.
Especially the last 10 nights, right?
Yeah, exactly.
Right.
So the mid-back people get a lot. The lower back, mid-back, and it's also the neck. You're constantly, I would say, if you're looking down in where you're going to make your sujood, then the neck position, because the neck's quite heavy as well.
Yeah.
So then people do develop a lot of neck pains as well. So those kind of 4 areas, the neck, the mid-back, the lower back, and a bit of the calves and the ankles, we can look at inshallah.
Inshallah. You mentioned the neck. I think I can agree with that, especially when you're in sujood and your body weight is on your neck. That's quite an impact, isn't it?
Yeah. And I think the body can feel it. So when the rak'ah is very long,
Mm-hmm.
long recitation, and then you go into ruku', it's like a relief in the lower back.
Yes.
So it shows that the back finds relief from the and you wish the ruku' was as long as the first one. So obviously it shows that the body needs it. It needs the stretch, but you need to have a mixture. So with all of the areas, you need to have maybe a stretch that you do, and something that strengthens the area.
Sure.
Obviously the body is not used to that kind of motion, but still strengthening it is good, especially if you find that other areas are painful and other areas are not. So for example, if you find that one side of your neck is painful and you're getting some radiating pain, that's something that you may have to get checked out, because obviously usually people get central pain. So if you get central pain just in the area of the neck, then that's fine. But if you're starting to get pain that's referred down, so now it goes down towards
Into
the
the
arms,
traps and stuff, yeah.
and then you get pins and needles, then it could be that you have a lot of muscle tightness around there, which is starting to impinge some of the nerves, or it could be something more complex as
Inshallah, inshallah. Okay, so let's go down and get to the basics, and you can show us some tips about how we can stretch properly during the day, and obviously before, it's because it is a form of exercise, right? Praying is a form of exercise. So what should we start with first, do you think?
Should we start bottom up?
Okay, yep, that's fine. Yep.
So what we was thinking, because the first one was going to check for your ankles. So you could use a wall for it. Is that okay? Should we try the wall?
Yeah.
So the first one is to stretch the muscle here. So obviously a lot of people get pain here and here. So what you're going to do is you're going to push against the wall and then keep bringing your feet back. So you keep bringing it back, but you have to keep the knee against the wall.
Right.
And then once you feel like the heel is starting to raise, then you stop and you hold that position.
I can
If you
actually
want
feel
to
that
try
already
that?
stretching, yeah.
So you keep the right leg against the wall, the knee should be against the wall. So then you bring this slightly forward. If I move this up the way. Yep.
Like that.
So, yep. And then if you stop there, you should feel the stretch here,
Feel that stretch.
which is the gastroc.
Right.
So this part here is quite good to stretch. And you usually hold this for around 20 to 30 seconds for this stretch. And you could do this 3 times. So you might hold it 30 seconds, rest, another 30, and then do that 3 times.
Yeah, I can, that's very tight.
And then what you can do is simultaneously, if you want to work on the bottom part, so you have 2 areas. So you have the big muscle here, and then you have the smaller area here, the soleus.
Right.
This time, this has to be against the wall. So if you swap feet,
This has to go against the wall.
yep.
Okay.
And then what you'll do is if you try to put the knee against the wall, and then just slowly bring the heel back. So keep the knee against the wall, and then slowly bring it back. You should start feeling the stretch on the lower part
Okay, right, got you.
of the leg.
Got you, yeah.
So it's just the opposite side, but now you're stretching the bottom part here, because some people do get a lot of pain across here. So then, again, this one you can hold for 30 seconds, 3 times 30 seconds, and it's a very good stretch. You can do morning and evening as well.
That is really good.
Okay, and you can compare. So for example, when you're at home, you can see, okay, how far can I go without lifting my heel, measure the distance, and then after a week or so, you can see if you've increased the flexibility in your gastroc and your soleus. Because that one is going to be maybe tight on one side or the other.
I felt the first one was like here, more upper, and the lower one was more here.
Yeah.
Down at the bottom.
Exactly. So that's a good stretch to do as well.
Sure.
So the next thing I was going to do was more mobility for the ankle. So another thing what you do for this one is whilst you're down, you'll be pushing down into it and then pushing up. So you're kind of trying to push into the ankle and up. And then, because for some people, that kind of motion, you should start feeling it. Some people can adjust it, so you might do it this way and then push it, but you might not be able to see it. But you're pushing into the ankle. If you try that.
Okay, yeah. So, like this, correct?
Yep.
And then, am I like doing that?
Push. Yep. Push into it.
So this is kind of stretching here at the
So
moment.
so it does work as a stretch on your kind of quads, but you're kind of focusing on this mainly, because for the ankle here, the kind of motion,
Got you.
it's more mobilizing the ankle.
Right, I can feel it now, yeah.
So sometimes if people do like a deep squat, they might feel this as well on the ankle. Okay. Good.
Motion, yeah?
Perfect.
Yeah. So it's kind of like flexing it the other way.
Yeah.
Yeah.
Cool. And then the last one with the ankle. So if people feel like, so I've done one stretch, one kind of mobilization. The last one is like more of like a strengthening one.
Right.
So obviously there's different variations. If people have pain in the ankle, then they may want to do just gentle ones. So they might just sit and then just bring their knee up.
Right.
And that's good just to strengthen the core. So you could do that around 16 times. You can add some pressure and you can do the same thing. And that's just a general pressure that you can put on the ankle. But if you feel like you want to put more pressure to it, obviously you could do it standing.
Okay.
That's a progression, so that's one. You can do it that way. If you find that easy, then you can go on to doing one, and obviously you might need a bit of balance for this.
Yeah.
Good. And then the last one, if you feel like that's easy, you can go like on a step, so on the stairs that you have, and you might do it going down. So you may go all the way down and then up. And that's a good strengthening one for the calf.
I can actually just doing that little bit there, I can actually feel a bit of relief.
Yeah, definitely.
Because it's been quite tense, like you're constantly like sitting down and standing up. You're not actually stretching anything, are you?
Exactly. And I think all of these things take time. So I think just as important as strengthening is, stretching is as important. So if someone wanted to build power, let's say generally, then you stretching the muscle will actually equal more power as well. So you can incorporate it and have a stretching day, even outside of Ramadan, and this will allow your body to be more supple as well, inshallah. So that's for the ankle. The next part is the lower back. So this is the most commonly injured place, I would say. When you're in prayer, again, when you're in rukuh, you do feel it slightly as well.
Can I ask you a question just on that note? So when I mean going into rukuh, so obviously your knees are supposed to be straight, correct?
Yep.
But then it's very hard. It's like to straighten the back. Can you see my back there? It's like it's literally. It's like it's not straight. How do I achieve going down more? Because I can feel it on my back, but then I feel it on my hamstrings as well.
Yeah, it's mainly down to two things. So it could be your hamstrings are quite tight, which doesn't allow you to flex more. So if you can loosen the hamstrings a little bit more and have more flexibility there, then you'll be able to go down fully.
Right.
And I think that's what it's possibly down to, because you can see if you bend your knee, if you bend your knee slightly, and then now go down, you can go down further. It's because and then now push your knee back.
That's tight.
Yeah. So you have to loosen the hamstring and possibly some of the glute as well, in order to allow that. So if someone goes down fully, obviously someone might not be able to go fully, which is fine. Obviously there's Islamic reasons and others. So obviously you're not going to be trying to go up here. You're going to try your best to go as down as possible. But generally, you can test yourself and you can improve that as well.
But you can't bend your knees, can you?
No. So you have to try to keep your knee as straight as possible.
Right.
But from a stretching point of view, so you can see how much you can go, and then you might think, okay, I'm going to see if I can increase that. So there's a few things you can do. Obviously, there's hamstring stretches, which I'll show you. But first, let's kind of go through if you have back pains.
Okay.
So you've seen that you only have limited back movement. So the one thing you can do is if you lie back, facing up.
Right, okay. Again, this could be done on any surface.
Any surface. So you can do it on your bed, you can do it on the floor, anywhere. So one thing is if you bend both your knees, and then you keep your feet together. So this is very good to relieve some back pains people get. And you can go, if you bring both knees to the side, good, and try to keep your body straight. It's just your legs that are doing the turning. And then if you bring your knee to the other side, but keep your hand and things. I know you might have things jingling.
And then just keep my body.
Good. So keep your body aligned. Your body doesn't change. It's just the leg that goes side to side. And then turn again slowly to the other side.
Like that.
Good. And then back to the center. Good. So that's one for the back. Another one you can do is you can keep this leg here and just drop the knee down. So just drop. If you bring it back up, and just bend this knee all the way down, and then back to the center. Hold on 3 seconds, and then this one. Keep this knee here, and you can feel some relief, because what this does is it kind of opens up, kind of hip. As well. So this is one good one as well. Okay. The third one you can do a stretch for the lower back is you can hug. If you try hug your leg from underneath, So you can either hold it up here or you can hold it underneath here. So if you put your hand underneath here, just relax your neck, don't stress your neck, breathe in and out. And with all the stretches, it's important that you manage your breathing, because some people are quite tense when they're doing stretches, and that can cause more problems either from the neck. So just relaxing with this muscle, with this exercise, and it's a nice relaxing one, making sure that the lower back is on the plinth.
Yeah.
Good. So that's for the lower back. Whilst you're there, we could show you another one to strengthen the lower back as well. So what you do is you bend your knees. If you bend both knees,
Right.
good. And this is called a bridge. So all you'll do is you bring the hip up.
Okay.
So bring it up, trying to make it nice and straight like that. Good. And you'll be holding it for around 3 seconds. Good. And then drop the hip. This is a very good one to do. It works on the glutes, it works on the lower backs, and it works a bit on your hamstring. So if you push up, and then what you'll do is you'll be squeezing the bottom muscles, squeezing it like you're holding in
Yeah.
like a Wii, and then you bring it down.
Yeah, I can feel that.
Good. And then push up again, squeeze, 3, 2, 1, and then drop. Good. If this is easy, there is changes you can do. So you can put like a ball or something in between. It could be a pillow, and all you do is you squeeze.
All right.
So you'll be squeezing it and then bringing the hip up at the same time.
So it's
And you should be feeling.
two squeezes then.
Yeah, exactly.
Yeah, that's a good one actually.
And this one you could feel. So if people have problems in the hip, it's good for women as well to do this kind of stretch,
Sure.
pelvic floor. So you squeeze a bit of abduction, and you're working on the lower back as well.
That is a very good one.
Okay. The last one, the last variation of the bridge. So I showed you a normal bridge, then I showed you kind of a bridge with an abduction. The last one is bridge with a adduction, sorry, then bridge with abduction, so going out. So bringing your leg out, you keep it there, and then push your hip up, squeeze your bottom muscles, squeeze, good, and then down. This one you're going to feel a lot more
Yeah.
from the other ones.
Yeah.
Good, and then push up, push, squeeze, 3, 2, 1, good. Perfect. And then should we do last one?
Yeah.
Good, last one, pushing up.
Like how I am now?
Yep, all the way up. Squeeze the bottom muscles, 3, 2, 1, and relax. Good. Perfect. So that's the kind of the 3 variations of the bridge, which is a good strengthening exercise for the back as well. Now, for your hamstring, so we said that if you have some tightness in the hamstring, you can be in the same position. What you do is you drop this leg down. You bring this, if you clutch your hands underneath your legs, and what you'll do is whilst you're there, just bring this leg up. Good, as much as you can. As you can see, there is some tightness there. And then bring it back down.
This one's my worst enemy.
Good, and then down. So make sure you do rest your neck. So I don't want you to have any pain in your necks. Good, and then push it up again. Good, so obviously you're going to aim to push more. And you can see that, and then down. So this is a nice one you can do. You can hold for 5 to 10 seconds. It's a nice kind of mobilization plus stretch. And then you lift it up. Good, and you can see there is a lot of tightness here. If you do have, obviously if you have someone there that can do the stretch, it's possible as well. But this is something that you can practice regularly and test yourself. See, can I at the end make it straight? And that's the aim. Okay, so that's for the hamstring.
Sure.
A good stretch for that. Obviously there's different variations, so many different hamstring stretches you can do as well, and the list can go on. But you don't want to complicate it. Sometimes doing one thing regularly is better than doing 100 first and then leaving them. So even if you get one of these exercises and you do them regularly and you find benefit, then that's better than seeing all of them and not doing any. So this one hamstring one. Shall we go on to the mid back?
Yeah.
Okay. So the mid back, people get a lot of pain, maybe from sitting, from maybe people who are working in the kitchen a lot. It could be brothers and sisters. They're preparing iftar, carrying things. You might get a lot of pain here as well. So generally for the back, neck, and lower back, we say that there are things like red flags if they're seen, then you should get medical assistance. So for the lower back, if you get things like saddle anesthesia, if you're feeling numbness in the lower back, when you're wiping, for example, in the toilet and you can't feel it, these things, numbness, bilateral, so pain going down both legs.
Right.
These stuff from the lower back, then you should get medical assistance. But if it's just general, localized pain, there's no kind of, it might be just down one leg, and you're not getting numbness around there, then that's fine. Similarly, in the mid back, if the pain is just around the muscle area, that's fine. If you're getting pains that are kind of banding, which are going around kind of the organs area, then you might be looking to get more assistance. And then the neck area, if you're getting any, they call it 5Ds and 3 Ns. So for the 5Ds, if you're getting any dizziness, if you're getting drop attacks or suddenly just falling, if you're getting any kind of, they call it dysarthria, so any slurred speech, for example, and they call something called double vision as well. So if you're getting anything like that, then you should get medical assistance. The 3 Ns, if you get any numbness specifically around the face, any nystagmus, so you may get kind of twitching of the eyes as well, or any nausea. And these things are more, you should get medical assistance. But they're not seen that often, but generally pain and these kind of symptoms, we say get medical. But generally for, if you get a mid-back, there's a few things that you can do. So the first stretch I'll show you, I'll just demonstrate it first for this one. So what you'll do is, you're going to be going sideways. So once you're sideways, obviously this is only working on one side, so you'd have to switch to the other side. And all you're doing is you're pushing out and then stretching back as much as possible. You should feel it in the mid-back and then back to the middle. And you do the same, pushing out and then back. And then you switch sides.
Was that similar to the one we did before?
Yeah, I was going to tell you, I gave you so similar. This is a very good one because the thoracic spine, it doesn't have a lot of flexion or extension. It more happens in the lower back. The mid back is more rotation. So you're rotating. That's what its main function is. So obviously you doing kind of rotation is very good. A very good stretch. It's hard to show. But imagine you had a door and you open the door and then you have like a thing that you can hold.
Right.
All you do is you switch your hands across and you pull across it. And then you put your leg across and you stretch.
Gotcha. And that opens up your back.
Yeah, and that's a very nice stretch that you'd feel in the mid-back. So imagine you're holding something, you're stretching it back. You should, and even if you hold, so imagine you hold my hands. So if you just hold my hands normally, we'll try to improvise. So hold it here.
Yeah.
So hold me there. So imagine Charles the door.
Okay.
And I'm stretching back. You can see.
Yeah.
That's a nice stretch I'm getting, and then you push it up, and then stretch. Good.
Yeah.
You're a very good door there. So that's a very good, and it stretches out the shoulder blades, and that's a good relief as well. Do you want to try it?
Yeah.
Shall we try?
Yeah.
So if you hold it across
that way,
and then pull back, so reach back. So keep the back straight. Good.
Yeah, I can feel it.
Good,
My
and
arms are,
then
like,
bring
pulling
it back up. Good, and then stretch. Really try to see your shoulder blades pulling out. Good, and then up. How's that?
Yeah.
Perfect.
I feel it's just like my back's just being
Yeah.
stretched.
So this is a very good. So those are two stretches: the rotation and the pulling. Very good for the back as well.
Sure.
Should we go for the neck?
Yeah, absolutely.
Okay. So again, as we said, the neck quite heavy. It's people get a lot of pain, not just in prayer. Generally, this is the most common
Head's quite heavy,
complaint.
right?
Exactly. A lot of brain cells. So with the head, obviously there's a general stretches that you can do. So you can do general flexion, looking up, extension, and then you might do left ear to left shoulder, lateral rotation, lateral flexion, sorry, and then lateral rotations are kind of moving, looking over the shoulder. So these are the general kind of stretches people do. But what I find a bit more effective, especially if you're getting pains across here, it is using your hands to push it further. Apply like overpressure.
Okay.
Okay. So what you'll do is you'll be holding like you're holding a chair, and what you'll do. That's okay. You can sit.
Sure.
Yeah. So what you'll do is you push. This drops the shoulder down, and then whilst your shoulder's down, it stretches the kind of the upper fibers of
All right.
traps
So you're using this to stretch.
pull. Yeah, pull this down, and then you use your other hand to pull your head to the other side, and you'd feel the stretch across that muscle fiber there. So when you're looking this way, that kind of the mid fibers that you'd feel. Then whilst you hold that stretch, you just look up to the ceiling and you change it, and then you'll feel like it's more stretching the back fibers of the neck. You feel that?
100%, bro.
And then the last one is you look down onto the floor, and then you can see it's more kind of the front fibers that you're feeling more stretched.
Yeah.
So there's 3 ways you could do it. You can hold them all for around 20 to 30 seconds, and that's a very good stretch for the neck.
That is a very good stretch, I think.
Yeah. So I would say do that both sides. If you're feeling the pain, you can do this at work, you can do this at home. Anywhere you find a chair, you can do this, which is a very good stretch to do.
Definitely. You can pat it for the door if you want.
It's okay.
You sure?
Yeah. So for the last one for the neck, one is like strengthening.
Right.
So strengthening for the neck muscles is a very good exercise. One of the probably the best one for the neck is more of a retraction. So for example, imagine your neck is like this. You're moving it from forward to back to squeeze it, and that strengthens the neck. So if you try that.
So I'll stand up first. So it's like literally head forward.
Good. And then pushing it back, squeezing it. 1, 2, 3, good, and then relax. So you can do this maybe 6 times. Squeezing it and holding it, so you should feel a bit of the stretch there. Good, and then down. So if someone gets a lot of pain, you would feel that kind of gives some relief, and it strengthens the neck. And sometimes, just because you have pain, it's not just massage that helps all the time. Strengthening and stretching both can relieve pain as well. And even if you have pain in a certain motion, still do the movement. And that's the key thing. People are sometimes scared of pushing the body. And that's a kind of key point. Whenever I see patients in the clinic, and even when I was in hospitals and stuff, people will come in, I've had a pain. Yes, the body sometimes, as a mechanism for safety, it stops or it limits the movement because it doesn't want it to injure itself further. So in a sense, you have to kind of push it a little bit. Obviously, if it's a fracture, if it's a full tear, that's different. But if it's a minor sprain, then do push it, do move it the way you feel like it's limited. If you have a bad shoulder, bad neck, move it into that motion. Those general things, so you have to kind of push yourself a little bit. If it's too painful, like I'm saying 6 out of 10 pain, and it lasts for a long time, then you kind of push yourself a bit too much. Otherwise, a general pain the next day is normal. After exercising and stretching, it's normal to have that kind of pain. And again, do consult a physio, a doctor, if you feel like it's not getting better. But generally, from these repetitive strain injuries that people get from prayers, from holding positions for long periods, stretching and strengthening usually helps with that.
Absolutely. Just before we wrap up, I know it's going to be quite close to the time of iftar coming up. So the foods that we eat, does that have an impact on the pains that we have in our body? Like, what advice can you give? Because I understand some foods can increase inflammation and pain. What advice could you give us on that?
So obviously with, especially when eating, so general nutrition advice that I would give is when you are breaking your fast, your body hasn't starved for the whole day. Then people usually like to eat a lot of like fried food, for example, a lot of sugary foods. And these things are not good for the body as well, especially if you have things like rheumatoid arthritis. There's different types of arthritis, osteoarthritis, osteoporosis. These things don't help with the joints, especially if someone's recovering from an injury. Sugary foods isn't good. Things like donuts, high in sugar, even though they are nice to eat. But luckily in Islam we have things like dates, which is part of the sunnah. And even just 3 dates is part of one of your 5 a day as well. So what I would suggest is when you're having dates, water, dates, milk, try to have some liquid beforehand, so it kind of prepares the body. Because before you're having rice or whatever meal you have, it's better that the body has liquid so it has time to digest.
Right.
Because this helps the metabolism as well, rather than like a shock to the system.
Is that what causes a digestive reaction? And you know, some people instantly feel like going to the toilet.
Yes,
Yeah.
it could be. I've had, subhanAllah, even here, I saw a lot of people vomiting this year. So I wasn't sure what it is, whether what they're eating, if it's heated properly, whether they're eating too fast,
Maybe,
too much, especially before prayer. Because I think the body, you can see that the body can stay the whole day, 16 hours without food. So you eating a little bit, you wouldn't pass away by Isha. Your body will still be able to cope,
Sure.
even if you had 3 days in just water. So I think, and even most of the imam who leads here, sometimes they say their voice is affected if they eat too much.
Yeah.
So just dates and milk, a little bit of food, and a trick to help if you feel like you want to lose weight or diet or whatever it is don't have food all on the table.
Right.
Put just what you're going to eat on your plate and just take that. Sometimes when it's a big spread,
Yeah.
you're going to keep topping and then adding. So I think the good thing is have a little bit and just have that, and you'll see that you can keep that routine even afterwards. Because it's the best time to start those kind of routines now. Your body, the stomach usually shrinks. You might see that we're not eating as much as we did before.
Yeah.
But you still have the same energy. Obviously, it took a bit of time for the body to acclimatize, but after a while, you get used to it. But just touching upon your question about inflammation, if there is foods that can help with that. So things like, they call it golden tea. They say milk with some turmeric,
Right.
honey, ginger mixed together. This can help with inflammation.
Okay.
And there's a few medications that you can get over the counter, like Holland and Barrett, which help with some inflammation as well. But generally, from a physio perspective, we advise a range of movements, gentle exercises with help with the inflammation. And if it's very severe, if it's kind of hot, you feel like it's red, then things like ice can help with that as well. But again, as a physio, we know more about the exercise. We touch upon the nutrition.
Sure.
But obviously, a nutritionist or a dietitian would know
Absolutely.
a little bit more than us.
Brother, Jazakallah khair.
Wa yak.
Your help has been beneficial to me, and I'm hoping it's going to be beneficial to the brothers and sisters out there. And again, we're going to have to shoot because it is coming up to the end of the day, subhanAllah. So guys, make sure you check out the link for this brother here. I myself have had treatment here, and this is not a promotion for him, this is to help you guys out. But definitely after Ramadan, come and check him out to get your therapy, the cupping, the physio, and also the advice. And the brother's a lovely brother as well. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuhu.